What's going on YouTube? It's Dan, it's Ken. It's Dan and Ken PT. And today, on this lovely day, we're going to talk about your hips and why they equal your core.
All right, time for some anatomy. So we're looking at the hip joint here. It's a ball and socket joint. So you have the acetabulum, which is a socket formed from the pelvis, and then the ball part of the ball and socket joint is from the femur. The femoral head goes into that, and you get that ball and socket joint. There are a lot of muscles here that are involved in the hip joint. Big ones, you got the glutes, you got the piriformis muscle, adductors. We will go into more detail in future videos on some of these muscles, but for now, just get the big picture of what's going on here. So all these play a big role in the function of the hip. We're going to go and talk a little bit more about why the hip equals the core.
Thanks for that anatomy lesson, Dan. Love to hear that beautiful voice of yours. Let me tell you a little story. So once there was a guy named John. It's not his real name. So he came into therapy with ankle pain. He works in construction, and he's been having ankle pain for a few months now. Now his therapist, he was a lovely guy. We'll call him Steve, not his real name. Steve looked at the ankle, it was swollen, it wasn't moving too well, so he did some ankle mobilizations. He strengthened and stretched the gastroc, your calf muscle. They worked on balance, intrinsic foot strengthening. And, John got better. He said maybe, 20-30% better. He was discharged from therapy. A couple months later, he started getting that ankle pain again. He went back to see that therapist, Steve, and, they kept working on ankle mobility, ankle strengthening, proprioception, things like that. Again, it got better, 20-30% better, and he was discharged again. Months later, guess what happened? You guessed it. The pain came back. So, John decided, you know what? I really like Steve. He's a great guy. We actually became close. Great therapist. I want to try somewhere else. He went to another location. He went to go see a guy named Tom, let's call him. Tom's not his real name. Now Tom, looked at the ankle. It was swollen, not moving well. Okay, let's look at the knee now. Knee looked fine. He took one step further. Let's look at John's hip. What did he find? Turns out John's hip on that involved ankle side wasn't rotating internally as much as he would have hoped, and in comparison to John's asymptomatic side. So what did Tom do? Tom worked on his ankle mobility, right? He still did all that stuff, gastroc, balance, but he also looked at his hip mobility, and he did manual work. He did hip strengthening, hip proprioception, massage therapy to the hip. And what happened? Well, with some education and with the treatment ideas that I just talked about, John became about 70-75% better within a few weeks and was discharged a few weeks after that. John called Tom a couple months later to thank him, saying how his pain and his mobility was consistently 75, 85, 90% better. He was doing well at work. So what's the moral of the story? Sorry to keep talking for that long. Well, the moral of the story is the hip controls the body pretty much, right? If you have ankle pain, you gotta look at the knee, you gotta look at the hip. If Dan has thoracic spine pain, you gotta look at the low back. If you have low back pain, you gotta look at the hip. The hip equals the core. It really does. So Dan is gonna show you a couple things to help with your hip strength and functional mobility. Enjoy, guys.
Alright guys, first exercise I'm going to show you is for mobility of the hip. So I'm going to show you a little dynamic hip flexor stretch. So the muscle group we're stretching is right in the front of your hip here. So you want to stagger your stance, get one foot in front of the other. You put your hands on your hip and you're just going to kind of lunge, lean forward. Keep this back leg straight if you can and keep that foot flat. So as you're going forward, you're feeling a nice little pull stretch right in the front at the hip flexors here. So this is going to help improve some of your hip extension. A lot of people can lack hip extension. If you're sitting down all day, your hip flexors can get short and you're going to lack a little bit of mobility there. So this is going to help to improve some of that hip extension here. So you could add this to your routine. All right, the next one is called the 3D kicks. This is going to help provide a little bit of stability for your hip on the standing leg. So go ahead and stand nice and tall, keeping this leg straight. You're going to use the opposite limb. You're going to kick forward, come back to the side, and then backwards. Forward, back, side. So you can see this leg is supporting all my weight here. So you're working on that stability, a little bit of proprioception, a little bit of balance here. If you don't feel comfortable doing this just out in the open, make sure you're standing in front of something you can hold on to, like a counter or a chair.
Bless you, Dan.
Thank you.
In conclusion, the hip is your core. It's as simple as that. It's the blueprint to the skyscraper, right? So as Dan showed, there are multiple things you can do for hip mobility and strength, and we'll make videos in the future covering plenty of others. But if you do have any questions, you could always email us at danandkenpt@gmail.com. We hope you liked the video. If you did, give it a thumbs up and subscribe. Again, as I just said, please email us if you have any questions, danandkenpt@gmail.com. And remember
Remember what Shakira said, hips don't lie.
they do not lie. Never.
And live,
Laugh.
love.